off-time roadmap. So I'm going to go through our definitions and framework for this debate, and then I'm going to move into my team's arguments, and I will signpost along the way. So you know what I'm doing. And my time starts... Wait, let me just move that. Sorry, my time starts now. First and foremost, let's define this house. We define this house as your average U.S. citizen. We want to focus on the U.S. for this debate just to confine it a bit, but it really doesn't matter that much. We're defining celebrates as we support the emergence of like a prominent telehealth sector. We're defining telehealth as the practice of online calls and consultations as an adjunct to traditional doctor's appointments. This does not mean that we want to get rid of doctor's appointments or hinder them in any way, especially when the doctor sees fit. However, we do think they're a useful tool in like the belt of a doctor. So now let's get into my our contentions. Our first contention is accessibility, which is broken into 5 subpoints. Our first subpoint is rural accessibility. There has been a trend of a decrease in rural hospitals, which is adding on to the fact that there is already, like, if you live in a very rural area, it is much harder to access healthcare, especially specialized healthcare. So being able to just hop on a computer and get that consultation is critical for citizens of rural areas. This allows everybody to have a more equal access to healthcare. It allows people in rural areas to not postpone like looking at treatments, and it allows them to more freely, get the treatments that they need. Our second subpoint B, is the strain on the healthcare system. Right now, or like, let's take 2 years ago, COVID-19. There was a huge strain on the healthcare system. There still is as a result of COVID-19 because there were not enough beds and not enough places for doctors to practice because there was an overflow. So telehealth in that situation was perfect, and it continues to be today because you don't need to go to a doctor's office. You don't need to actually use up facilities, so you're straining the healthcare system less, right? Which is critical because less strain on the healthcare system means that doctors and nurses and other medical practitioners can practice their jobs better without focusing on the logistical side of the job, right? And better doctors, better nurses, better medical practitioners is critical to having a good healthcare system that works for all. Our third subpoint C, is about the differently abled. It is often very hard for differently abled people to get into to get to their appointments, right? And using telehealth as an alternative to some appointments that would otherwise have to be in person is critical for these people to access the healthcare that they need. Instead of having to make sure their doctor's office has a spot for wheelchairs and has the ability to take care of them and all of that stuff, and instead of having to go through the hassle of getting transportation that works for them, they can just do it safely from their home and easily. Our fourth subpoint is about caretakers. Right now, mothers, fathers, and caregivers of small children, as well as people who have elderly parents or are caregiving for elderly people, aren't able to, or it's significantly difficult for them to access healthcare, right? It's very hard for them to have to set up a babysitter, which can be expensive, or set up a nurse to take care of their loved one or or the person they're caregiving for. It's very hard for them to do that and also get the medical help that they need, and deserve. So having telehealth allows them to continue doing their job, continue taking care of those that are entrusted in their care, while also getting the help that they need and protecting themselves. Our fifth and final subpoint for this is about low-income people. Telehealth is nearly half as expensive as traditional doctor's appointments, and this is because of a lack of travel fees, a lack of necessity for facilities, and in some situations a lack of need for hospital stays, right? All of these things add up to immense costs that deter people of low and middle income Americans from getting the help that they deserve. And telehealth allows them to get that help, get those consultations from doctors without having to jump through all of these hoops. So what does this point come down to? It comes down to the fact that everybody deserves healthcare, and telehealth allows that. Our second point is convenience for doctors. It is much more convenient for medical practitioners to practice in any place at any time, rather than the setting of a traditional appointment. it is also helpful that people can do this whenever. Let's take the example of a mother or father who has a baby who suddenly had a fever in the night. This is very common in young children, and oftentimes these parents end up just like searching Google to try to figure out what to do. With telehealth, they can literally just hop on a Zoom with whatever medical practitioner they work with, or like a hospital, and figure out what they need to do for their children. This is critical, and we want to help babies, right? Although this does work for everybody. Our third argument for this is about pandemics and infectious diseases. This should sound pretty common. This should sound pretty relatable, since we just went through a pandemic. Telehealth allows doctors to diagnose infected patients without risking other patients or risking the spread of a disease. For example, with monkeypox, something that's going around right now, doctors can diagnose their patients, or oftentimes can diagnose their patients via Zoom or like another streaming service, and that way they don't risk anybody or themselves, but also can help those people and treat them or give them like prescriptions or whatever they need. And our fourth and final argument is broken into two subpoints, but essentially it's about better treatment. First and foremost, there's a faster diagnosis, right? Oftentimes doctors don't need to see you in person to diagnose whatever's going on, right? For example, let's use the example of monkeypox again. If you have like the pores on your skin or like the bumps on your skin from monkeypox, a doctor can diagnose you very quickly from the screen without you having to go through that hassle. And that quick diagnosis means faster treatment. It means that you're like, if you catch something early, you can nip it in the bud. So it means that you're less likely to get severely sick and less likely to die from said sickness. And then our second subpoint about in this better treatment argument is about recovery. Oftentimes, people who are recovering from surgeries need to go into hospitals or other places for physical therapy. It's hard for them to travel, but they need to do it. Or they need to stay in hospital beds longer than they actually need because they can't access a physical therapist any other way, or any situation like that. Telehealth allows physical therapists and other people who work with recovery to consult with their patients, and without the patients having to travel far, right? And without the patients having to risk re-injuring themselves. This is critical because it means that less people are getting re-injured or severely sick. This point as a whole is critical because it means that less people are getting re-injured or severely sick. It means that there's less spread of infectious diseases, and it finally means that there's better allocation of medical resources. For all of those points, I urge you to vote for the government side.
Okay, may I begin the first opposition speech?
Wait, I'm sorry, I can't hear you.
Yeah, me too.
Oh, now I can hear you.
Okay, all right, cool.
Yeah.
So judges, are you ready? Opposition, are you ready? Or affirmative, sorry, are you ready? Opponents, are you ready? And partner, are you ready? All right, awesome. Let's get started. Hello, judges. My name is Novice, and I will be arguing for the negative side of the issue. This House celebrates the rise of telehealth. Again, that's this House celebrates the rise of telehealth. I'd like to start off by refuting some of my opponent's points. My opponents claim that accessibility is a major factor of telehealth, and it's a great improvement. But in fact, telehealth does not support rural accessibility, since many rural areas don't have access to infrastructure to access telehealth. Furthermore, telehealth has increased the amount of divide between the care that people of different socioeconomic statuses receive due to their geography, income, education, language, and their technology literacy. People living in rural areas with lesser technology literacy and lesser infrastructure, where they may not have the technology or the literacy to access telehealth, has increased the divide of healthcare in the United States. Furthermore, Judge, the strain on the healthcare system. The affirmative uses the example of COVID-19, but the condition of hospitals has drastically changed since then. So using this example may not be indicative of the healthcare system and the House's opinion on telehealth currently. Judge, what is the point of accessibility if it doesn't give patients the option of the best healthcare? According to a 2020 survey, many patients were multitasking during their telehealth visits, and telehealth also leads to misdiagnosis and data breaches, which I'll reach later in my speech. I'd like to also, yes?
Isn't misdiagnosis common in any form of healthcare?
It's more common in telehealth, and I'll get into that as I move on. Furthermore, I'd like to comment on the affirmatives example analogy of a sick baby. Parents that have a sick baby in the middle of the night must search for an in-person service. In fact, telehealth has led to a greater amount of misdiagnosis, and misdiagnosis in the state of a sick baby could make the baby's sickness worse, and it could exacerbate the problem. Furthermore, the affirmative claims that telehealth leads to a faster diagnosis. Judge, it may be a fast diagnosis, but if it's a misdiagnosis, telehealth is not effective. And also, a major problem with telehealth is that telehealth has directly led to data breaches of people's personal medical information. In 2021, the healthcare data breaches hit an all-time high due to the rise of telehealth during COVID-19. And these data breaches have impacted tens of millions of people. Again, that's tens of millions of people whose personal medical information has been leaked due to telehealth. Nearly half of the medical care during this time was due to hacking, and the largest breaches of 2022 were reported in May of 2022 at the American. Yes?
There's in like the early 2020s, there was also a huge increase in the digitalization of like literally just healthcare records. So how is there like this could just be correlated, not causation?
So hacking leads, and I'll get into this in my next point. Since in telehealth, data is transferred from home computers to medical computers, there's a large amount of hacking that goes on people's personal computers. Many of third-party billing collections firms and other areas have been hacked due to malware and spyware on people's home computers in which they transfer their medical information compared to holding that medical information securely on a medical database. Judge, I'd also like to refute their definition of a moral citizen. A moral citizen would weigh health and accessibility over anything else because they are moral. Yes?
I just want to quickly clarify. We did not say moral citizen. We said an average citizen in the United States, not a moral citizen in the United States.
Right, but the definition of an average citizen in this house is somebody who has moral capabilities. And we would like to shift the definition to the judge and the debaters, since the definition of an average citizen changes the model of the argument. Furthermore, lack of insurer coverage in telehealth services is a major problem in telehealth. So the majority of insurers don't provide coverage for telehealth visits, and this is a problem since this increases the cost of telehealth for people. Furthermore, the affirmative claims that telehealth can help people who are not able to visit the doctor, but Judge, all telehealth can't replace all of in-person visits, and these people would still have to make accommodations to visit the in-person services due to some examinations not being able to be done online. Furthermore, 55% of physicians say that what their patients expect to accomplish virtually doesn't align with what's feasible in virtual care models. So the public has a different opinion from the doctors that are not very comfortable with telehealth. And furthermore, many important tests that are required to diagnose a patient are not able to be done over a virtual environment, such as blood pressure or cholesterol levels. And they decreased the amount of in-person doctor visits during COVID-19, which not only led to a greater amount of data breaches, but also overall problems since people were not able to visit in-person areas. And this led to a decrease in cardiovascular screenings, which is important for the prevention of heart attacks and strokes. This is because cardiovascular disease is the #1 killer in the US, and one person dies every 34 seconds in the United States from cardiovascular disease. So a model of medicine of diagnosis that can't even screen for the important things for the #1 killer in the United States should not necessarily be celebrated. Furthermore, due to the rise of telehealth, people have become more reluctant to visit the doctor in person, and blood pressure checks have dropped by half.
POI.
Yes.
Are we sure, again, this is a correlation, not causation, POI. Are you sure that that's not because there was a deadly pandemic correlating with the
This
rise
is
of
current
telehealth and
information,
not just the
so-
existence of telehealth?
Yeah, so this, as telehealth rose during 2022, so I'd like to go back to a source. During 2021, during the rise of COVID-19, during the rise of telehealth, more people have become acquainted with telehealth as compared to before. This is also directly correlated with breaches hitting an all-time high in 2021 and impacted tens of millions of people. This is also correlated to people becoming more comfortable with staying at home and not actually going to an in-person doctor. People not getting their normal and routine checks because of problems that are caused by telehealth. And this poses great risks to these people. Furthermore, people are distracted during these telehealth appointments, and these may not be the most effective way of serving healthcare to the general population. According to a 2020 survey, many patients are distracted during their telemedicine appointments, and the majority of respondents claimed that they were multitasking during telehealth visits. Telehealth is not able to do many of the routine checks that are required to screen for important diseases, and they also lead to many problems in misdiagnosis and data breaches. Furthermore, just online, people may not be comfortable with doing these certain examinations online, and also sharing information online may lead some physicians and doctors to feel uncomfortable, and this is why telehealth should not be celebrated. Furthermore, an 8-month breach occurred on a company that affected tens of millions of records. This would not have happened if this was in-person doctor visits, which are more reliable, which have been known to hold patient data securely, compared to malware and phishing attacks that have happened on people's personal home computers, where they're not sure who they're sending their medical information data to. This is very dangerous since other forces could gain information about the vast majority of the American people. And these reasons are why I think this is a strong vote for the negation. Thank you.
Okay, give me a moment to set up my timer and I will quickly give an off-time roadmap. Yeah, okay, before I get into it, just a quick off-time roadmap. Okay, so firstly, I'm going to go over the gov case and rebuild our arguments. And then I will go and parse out the op case and refute their argument. Okay, so my time starts my first word. Okay, firstly, for the gov case, I want to start on the gov case by just going over the definitions. Okay, so my opponents essentially refuted our definition of an average US citizen by saying that with a counter definition of a moral US citizen. First off, I don't know if this is actually that pertinent to the debate either way, but I just quickly want to explain why ours is better. First off, they didn't even explain like a reason why we should change definitions. They didn't actually give an issue with ours other than the fact that it quote unquote changes the model of the debate, even though they didn't explain how. So just before we get into the rest of my speech, I just want to clarify that the government definition of this house still stands. Although I don't think it has that much effect on the debate, so it shouldn't be too big a deal on your ballot. Anyways, without further ado, I just want to go into our first contention. So our first contention about accessibility. The idea is basically telehealth can make medical care more accessible to more people. They refuted our first definition, or our first subpoint of rural accessibility by saying that many rural places don't have access to infrastructure for telehealth. If we're talking about U.S. citizens, this is just objectively not the case. The vast majority of U.S. citizens, even in like deeply rural areas, have access to the internet. In fact, I'd say access to hospitals is probably more gate kept behind class than access to internet, which means internet is actually probably a better way for people who are working class, who don't have as much time, who perhaps don't have a hospital near them. That's actually probably a better way than traditional hospitals. So the accessibility argument still stands on our first subpoint. They didn't even respond to our subpoints about strain on the healthcare system, differently abled people, or caretakers. So yeah. So our impact still stands about more people having healthcare at lower prices. Okay. So on our second argument regarding convenience for doctors. Okay, so they responded to the example we gave where basically, okay, actually I'll go over the convenience for doctors argument. So the convenience for doctors argument is essentially saying that the government believes that I think it's more easy for a doctor if they don't have the restrictions of being in office, if they don't have time restrictions, if they don't have scheduling restrictions. That's far, far easier for them to communicate with patients at a time that works for both of them. We brought up the example of like a sick baby in the middle of the night. And you quickly need to get a diagnosis, see what can we do, what prescription should we get so we can give it to them tomorrow. See, that's the kind of thing that you would ask that you would ask a doctor in a traditional appointment in 1 day, 2 days, 3 days, because they have to be in office in a traditional appointment. Because they have to be in office in a traditional appointment, because they have to be, there has to be a time where there isn't another patient for a traditional appointment. But if using telehealth, you can just call them the minute of. You can just be like, oh, my baby's sick. What can I do? And the doctor can give advice. My opponents refuted this by saying that parents with sick babies in the middle of the night should seek in-person service. I've already explained why this is by no means viable, especially for working parents who might like have work the next day. And they'll have to wait days and days until a weekend or until a time where they're free. And then that will be the time where they'll be able to where they'll be able to diagnose their sick baby. My opponent's second refutation to this was apparently that there are misdiagnoses through telehealth. As my teammate already mentioned, there are misdiagnoses regardless. But even if there were to be a higher rate of misdiagnoses, which we can't be sure because we should disregard any citations my opponents made to prove this point. But even if it were like more prone to misdiagnoses, the fact of the matter is, in a more serious situation where misdiagnoses could really end up being a big deal, then yes, you should seek in-person appointments, and that's why we said that we wouldn't like to propose telehealth as a singular appointment. We said it would be an adjunct to the current like traditional appointments, and my opponents conceded this by not responding to it. So yeah. Okay, now that I've rebuilt both of our contentions and both those impacts still stand, I'll move on to my third and fourth, and then we'll move on to the out case. Okay. As for my team's third contention, about pandemics and infectious diseases, we brought up the example of COVID-19. In response to this example, my opponent said it's not indicative of current times. This is true. In the present, we are not undergoing a pandemic, which means that it is probably not like our top priority right now to mitigate like a pandemic that's happening right now, obviously. But at the same time, preparedness for a pandemic is actually more important than preparedness during the pandemic, because what happens is, like as we saw during COVID-19, it was not like we should only start caring about pandemics when they start happening, because that's already too late. We need to start caring about pandemics when they're not happening. We need to start building the telehealth infrastructure that can allow people to go to the doctor without getting sick. The impact of less pandemics and less viral spread stays on contention one. So okay, now onto my team's last contention about better treatment. Okay, so my opponents again just responded to this by saying misdiagnosis, and they entirely avoided the subpoint. And they entirely avoided the subpoint regarding recovery. So first off, faster recovery and easier recovery still stands. With like a physical therapist and so on, that impact still stands regardless because they conceded to it by not responding to it. So yeah, but as for the faster diagnosis thing, again, as I mentioned, in a very, very serious situation where they're like, serious and difficult to comprehend systems, it is at the doctor's leisure that they can in fact invite the patient to an in-person visit. But having that option for lesser and easier to diagnose symptoms is still a very important situation. Again, so when a misdiagnosis could end up being a really big deal, that is when we would propose an in-person appointment. And as we've already conceded, yes, no, in no way can a telehealth completely replace traditional medicine, but that is never a claim that we've made. Okay, now that so the impact of recovery still stands, and the impact of faster diagnosis still stands. Okay, now that all our impacts still stand on our case, I would like to move on to my opponent's case. Okay, my opponent's first contention is about data breaches. Essentially, their claim is that is that basically because there is now more information and medical information on personal computers, that it's more prone to data breaches and hacking. Yes, of course. Whenever you have more information on computers, that information, it's easier to steal it. But this same logic could be applied to a lot of things. This same logic could be applied to online banking because technically there is more bank details on personal computers now. It could in fact even be applied to people's names or like, you know, professions. And maybe we should stop emailing each other because that would actually mean there's less personal information on personal computers. Obviously, this is a complete slippery slope. This applies to many things. The fact of the matter is that whenever you put information onto your computer, whenever we digitize something, it is a necessary step to put that on personal computers. And yes, technically it can be stolen, but essentially this is a risk that we have to take to move on to a more digitized future. My opponent's second argument is, oh, by the way, on the op case, they didn't really label their arguments very much, so I'm kind of just parsing these into arguments. If it looks a little bit different on your flow, you can find wherever you put this. But yeah. Okay, so as for their second contention about telehealth not being effective, I would just they brought up cardiovascular disease. And again, yes, you can't get cardiovascular appointments through online. That is very, very obvious. But the thing is, you don't have to. You can, in fact, get those in person. Like it's, again, telehealth can be an adjunct for like less severe cases. But if you do need a cardiovascular checkup that you haven't had in a while, do it in person and just wait to schedule it a little bit later. Thank you for your time. Thank you, Judge, for your time. And I urge you to vote for the government side.
All right, Judge, are you ready? Okay, opponent, are you ready? Teammate, are you ready? Perfect. Okay, so before I begin, I'd like to give you an off-timer map, just to make this debate a little easier. So I'm going to be going down the flow, refuting everything my opponents have said, and then go back onto my own case. And if time permits, I'll impact on my own case and just show why we should overall win the debate. Okay, my 8 minutes starts on 3, 2, 1, go. Hello, Judge. My name is Nico Bagipoli, and I'm on the negation side of the resolution that this House celebrates the rise of telehealth. So, Judge, let me start off with a little bit of a cloudy point in this debate. So, Judge, the average citizen, average U.S. citizen, Judge, our opponents use that as our definition for this House. So, Judge, we'd actually like to refute that and define the House as the judge, because the average U.S. citizen might be able to have some kind of previous bias in this situation, Judge, because of the problems and the health problems behind this, Judge. It overall leads to a worse quality of life. So, Judge, I'd like to just, clear that up and just define it as this, as the judge being this House. So, Judge, moving on. Access to the internet. So, Judge, our opponent said that everyone has access to the internet. In fact, it's harder to get to hospitals. But, Judge, it's not access to the internet. It's access to good internet that's quality, that can actually stay and sit throughout the entire meeting, Judge, because this is someone's life on the line. For example, Judge, a man in San Francisco, he was diagnosed with a cardiovascular disease, Judge, and a doctor using telehealth came on and told him, "You're going to die." Right, Judge? This was just a glitch. This was a glitch in his internet, Judge. He said, "You're not going to die. You're going to be fine." This man, Judge, was put in a serious situation where he was panicking. Judge, there's an entire article written about this and how this man thought that his life was going to end in that very moment because of an internet glitch. Do you understand the seriousness of the situation, judges? This can alter a person's life with just the simple phrases of a couple of words. Sorry, I won't take it. Sorry. So, Judge, it overall means that the person's life can be changed with just a couple of words. Judge, internet and all of this stuff, Judge, that is so important. And, that's all makes sense, Judge. So then they talk about caretakers and all that, Judge. As refuted in my first speaker speech, I already refuted that and covered that. Then with data breaches, Judge. So with data breaches are terrible, Judge. Information is gone. But our opponents are talking about email. Using an email and all of that, like, oh, we have to get rid of all information. That simply makes absolutely no sense, Judge. This is medical information. Like real medical information, Judge. This stuff is not like if this is breached, it could harm a person's life forever. Yeah.
How is this not comparable to bank information? That could also compromise somebody's life if it.
Yeah, but with bank information, Judge, there are so many more security measures possible, Judge. There's the way that these telemedicines work, Judge, is that in the past, it has proven that it has had breaches, Judge. There have been 11 breaches over the course of the last 8 years, and specifically with telemedicine, Judge, and telehealth. Overall, that is basically what is happening right now. So if you look at it, telehealth is more susceptible to data breaches and everything, Judge. And also with the idea of online banking, Judge, online banking has actually been the target of so many crimes, Judge, and that is why most banks are actually trying to offer more in-person services by asking people to come in person instead of doing it online. For example, Judge, there was over 3 million checks that were breached from Chase Banking, Judge, because of online banking. So, Judge, this is not what the debate is about, Judge. The debate is on telehealth, not banking. So we also do agree that banking online can be dangerous, but that is not what this debate is about. Next, Judge, when they talk about how, online diagnosis is, in person can also be correct, wrong. Judge, I would like to bring up an example from very recently, Judge. In June of this year, a man walked into a San Francisco hospital with monkeypox, Judge, and he did telehealth visit and he was diagnosed with monkeypox. At that moment, thought his life was ending. Once again, Judge, another scenario of how telehealth has not been helpful. Whereas in reality, Judge, he just had allergies. Judge, he was diagnosed with the wrong thing because of telehealth. He had to go to they automatically ordered, come to the office, we need to give you some medicine, Judge. And this, once again, is a big article that really showed that telehealth can be so dangerous. It is not the future of medicine, and it can be so dangerous and almost harm a person's life. Judge, then they talk about how, faster diagnosis and faster solutions. I can refute these two, Judge. Judge, it might be a faster diagnosis, but that's the thing. Will it be correct? As the example I just stated earlier, will it be correct? This is so true, Judge. It's so susceptible to actually being a wrong misdiagnosis because of the current situation. Judge, even with that, they say that they can get help faster. But Judge, with telehealth, blood pressure checks dropped by one half, Judge. They cut in half. Cholesterol tests fell by a third, and new medicine visits decreased by a 4%, Judge. So it decreased, Judge, by 25%. It fell completely because of telehealth. People who went and did these online things said, okay, I'm fine, I'll go get it tomorrow, right, Judge? Instead of just going to the counter outside of your doctor's office and going and get the medicine. Overall, Judge, that's all of that. And then they talk about how physical therapists and everything about that. But Judge, as a person who personally goes to physical therapy right now, I can tell you 100% that the impact that it has of going in person is not is 10 times better than doing it online, Judge. Because online, it doesn't matter, Judge. You can't see what posture you're supposed to be holding it in, Judge. There's so many more problems with telehealth that overall it harms the people, Judge. It harms your health. It makes it dangerous, Judge. This can change a person's life within a minute, Judge. Telehealth is so harmful, Judge. Then they talk about how, for small babies, they can just call the doctors up. Judge, are doctors going to be waiting at every waking moment, ready for your call? That is not true, Judge, and that won't change the situation. It doesn't matter. Sure, yeah.
That is the exact premise of hospitals, right? There's doctors always there 24/7, right? And telehealth allows you to connect with those hospitals immediately.
But the diagnosis that they give won't be correct. It simply won't work because with telehealth, it has proven in the past that the diagnosis that they provide won't be correct. Judge, this in itself won't work, Judge, because we've already proven that telehealth has been so dangerous in the past. It causes so many more problems. Judge, with telehealth, there's a strain on the healthcare system, and the affirmative uses the example of COVID-19 a situation that hospitals, have drastically changed. But Judge, what they do not understand is that accessibility cannot be the best option because Judge, it doesn't matter if it's accessible right now because the solution to that, Judge, what comes out of that visit won't work, Judge. Because, say for example, right, I'm getting an online visit with one of you guys, right, Judge? You guys are my doctor and I'm talking to you and I'm understanding what you're saying. Right, Judge? 75% of all men reported that they were distracted during their telehealth meetings, Judge, during their telehealth doctor's meetings. And 40% of women also reported that they were also distracted. Judge, this in itself shows that distractions are a huge part. If you're sitting in a doctor's office and your doctor's talking to you face to face, sorry, I won't be taking any more of my speech. You guys have been telling too many. So, Judge, if you're sitting right in front of me and talking to me face on face, Judge, that material will stick in my head so much better, Judge. Not only do you as the patient understand what's wrong with you, you are not susceptible to distractions and, misinformation and all of that, Judge. Because once again, as I already stated with my example of the man who thought he was going to die, but turns out he's not going to die, Judge, that in itself shows that example proves that the problem with these internet things and everything is just too big, Judge. It's such a big problem. Yeah. So, Judge, even though people in rural areas have access to the internet, medical data, video, and image, it requires a large output of internet and, some individuals don't have access to that. So that means that cuts down on their point of accessibility. The affirmative has also not mentioned our main point of cybersecurity and the dangers of malware. So that one is dropped, Judge. That point comes to us. The affirmative also uses faulty analogy theory because the details that they state about bank details, such as names and emails, can be stolen. Telehealth is okay to conduct online. This is a faulty analogy, Judge, since the data is extremely private and can be carried on with the person for the rest of their life. The amount of pressure that is shown with telehealth, Judge, the importance of telehealth and those data records are so much more important. And regardless of the development of telehealth infrastructure, telehealth will always be hackable. Even government agencies are hacked today, and many people are hacked with malware on their computers. So we should not be putting this detailed information on the online, Judge. My time is up, and I strongly urge an opposition ballot for this debate. Thank you. My time is up.
Okay, may I begin my third speech? All right. Is the time for this one is, I think, 4 minutes?
That's correct.
Okay, 4 minutes. All right, judges, are you ready? Opponents, are you ready? Awesome. Partner, are you ready? Okay.
Yes.
I think he's ready. All right, let's get started. My time begins now. Judge, I'd like to start off with a couple of points about why telemedicine should not be celebrated. Telemedicine has records that can be compromised. As my partner mentioned, the only refutation that the affirmative has to the compromised data is a faulty analogy logical fallacy. The affirmative compares it to bank details, but Judge, when bank details are compromised, they're changeable. People have multiple bank accounts. At most, sometimes people have $100 charged on their account, which can be refunded. They can change their bank details and the story's over. However, when medical details are compromised, this is not something that can be changed. People don't use medical details to buy groceries at the supermarket, and people's medical details are extremely private, and millions of... no, I won't be taking any more. I'm sorry.
It's a POO. You have to take it.
Oh,
No,
okay. I see.
Yeah, last time. This is a completely new refutation in the third speech, and therefore should be disregarded.
It's a refutation. It's a refutation, so it still stands.
Refutation. You can't have new refutations or evidence or argumentation in the third speech.
You can bring up new reasoning and refutations.
Well, wait a minute. So, new arguments are allowed in the final speech in the BMR. Sorry, in the rebuttals. What specific argument is being called new?
The refutation about like not being able to change medical records.
Okay, so would like to point out where on the flow they think that argument was made earlier?
This is a refutation to that argument. So I covered it very briefly in my speech, so he's just delving into that as a refute. So it's still a refute.
Okay, I think the judges can all take that into consideration.
Okay, thank you.
All right, may I resume my time? Okay. Furthermore, telehealth has increased the amount of social divide in America since the affirmative mentions that many rural areas have access to an internet connection, but as my second speaker mentioned, a stable internet connection is necessary. And furthermore, many photos and videos have to be transferred, which can also lead to data being compromised, as I've mentioned many times throughout the speech, which the affirmative has not really provided a strong argument towards. Furthermore, even though the affirmative argues that telehealth can work in conjunction with in-person visits and they're not necessarily decreasing the value of in-person visits, it can be empirically proven that telehealth has led to a decrease in people's willingness to go to an in-person visit. It's directly correlated. After the COVID-19 pandemic, people have been less likely to visit the doctor. As I mentioned before, blood pressure checks dropped by 1/2, cholesterol tests fell by 1/3, and new medication visits decreased by 1/4. Judge, these are tests that are necessary to detect some of the most dangerous diseases in society, and this is why telehealth should not be celebrated by the judges or the people. Furthermore, I'd like to mention that telehealth overall has led to many problems, and telehealth is not a complete solution. It will never be a complete solution for in-person visits, since it isn't possible to do every type of visit remotely. people have to go into an office to do things like imaging tests and blood work. A blood test can never be taken online, and in-person visits will always have to remain over telehealth. But due to telehealth, people have been more reluctant to take these blood tests and take these cholesterol level tests, and this is directly leading to problems in the public health. Furthermore, the security of this personal health transmitted online is a major concern that the affirmative has not addressed. And medical information is some of the most private in society, and millions of people's medical information, images, and videos have been leaked and breached, and this is a major problem in the telehealth system, which should not be celebrated at all. And furthermore, insurance companies are not, many insurance companies are not covering the costs of telemedicine. And this is also a major problem since telehealth is not necessarily supported or celebrated by even the insurance companies.
Point of order.
What? Sorry?
Point of order.
Yes, I'll pause my time.
You brought up insurance before.
This was brought up in the first speech.
I
This was brought
didn't
up in the first speech. Judge, if you could look over your flow. I believe this
The
was.
judge will take it into consideration.
Okay, thank you. I'll wrap this up now. So overall, telehealth is not something that should be celebrated. It increases the divide in America because rural communities, even though they may have access to internet, they don't have the throughput to output photos and videos, increasing the divide between people of different income levels and technology literacy levels. Furthermore, data breaching is a major problem in telehealth and should not at all be celebrated since medical information is some of the most private. And furthermore, it isn't covered or celebrated by many different people throughout America, and it isn't supported by physicians. And this is why I think that this should be a strong ballot in the for the opposition. Thank you.
Okay, I thank my opponents for their speech. Just a quick off-time roadmap. I'm just going to go over the definitions very quickly. Go to their case, just kind of go over my case quickly, and spend most of my time weighing. And my time starts now. My opponents brought up a new, different definition than the first definition that they decided to contest with in their second op speech. That should be disregarded for that reason alone, as well as the fact that, yes, Judge, an average citizen is a perfectly acceptable thing. An average citizen might be biased, but that's completely irrelevant. Bias of an average citizen is irrelevant. It's about what's best for them. So now onto my opponent's points. Like my teammate mentioned, they didn't really organize their points. So I'm just going to go through the biggest points in this that they mentioned, and you can find those on your flow. I'm sorry for the confusion. So on the hacking point, my opponents have talked about how people can't change information, how there's a lot of hacking. Okay, but I have a question for my opponents. So what? What's the significance? My opponents say, okay, people are hacked. Your medical information being stolen doesn't sound good, but has anybody died from it? Has it caused severe sickness? What does it cause? Does it cause, my opponents have never expanded the significance. They've just given us an assertion and some reasoning. That's great, but it should not be weighed in this debate if it has no weight. And on top of that, please apply my teammate's refutation. My opponents also talked about misdiagnoses a lot. However, they gave you 2 examples. However, A, disregard examples because you shouldn't be researching for these debates, and B, we should consider the fact that while misdiagnosis is not good, in the examples my opponents pointed out, the person eventually just went to the doctor and got an actual diagnosis. So I don't see how it changed anything at all, right? My opponent, it didn't cause any death. It caused one guy to be shocked for a moment, but I think he was fine 5 seconds later. I mean, that's not pleasant, but there's no tangible impact in that. So while misdiagnoses might not be great, my opponents, the impact of them is not that huge, and my opponents have never quantified how much misdiagnoses there are. So that should be irrelevant in this debate. Also, it's better to have some diagnoses than no diagnoses. So just consider that as well. My opponents pointed out that telehealth is not a replacement. We agree. It should not be a replacement for regular medicine. And so we agree with that, right? There's both. It's an extra tool in the tool belt of a doctor, right? We got that. My opponents also said people are less likely to get tested, and they were less likely to get tested with the rise of telehealth. They ignored the fact that there was a pandemic going on. Typically, when there's a pandemic, when hospitals and doctors' offices are overfilled, you're not going to get tested. And while that's not good, I call this correlation and not causation, right? It's not because of telehealth that people weren't getting tested. It was for fear of getting COVID. A deadly disease. Onto my own team's case. For accessibility, my opponents have never refuted, not once, subpoints B, C, D, and E on our first contention, right? So that's about strain on healthcare system, differently abled people, caretakers, and low-income people. They've never refuted these. These flow through, and we gain the impacts for all four groups. In terms of rural people, my opponent said that you're not gonna there. It increases the social divide. Well, rural people don't have hospitals in the first place, so any access to a doctor is good, regardless of the quality of your internet. But also, good internet is available. Take the example of libraries, which are spread throughout the U.S., freely available, have great internet. Yay! So good internet is available. My opponents, in terms of convenience, my opponents have basically refuted this by saying that there's misdiagnoses. I've refuted that, so just cross apply that refutation. In terms of pandemics, my opponents never refuted my teammates' frontlining of this contention, so that flows through, right? Telehealth is important in preventing a future pandemic and stopping the spread when such a pandemic comes. Right, and we see monkeypox as an example of something that could grow into a pandemic soon. In terms of better treatment, my opponent said that faster does not mean it's correct. So that's essentially the misdiagnosis argument. So cross apply that refutation once more. And in terms of the recovery standpoint, my opponent basically said that personally they felt in-person physical therapy was better because they had experience with it. That's great, but I don't think you have any point of reference, nor does your experience speak for the experience of millions of Americans. And when you've just had, it's anecdotal. When you've just had surgery, right, you can't really go to a physical therapist, or you might risk re-injuring yourself on the subway or whatever, or like taking a car, whatever it is. And regardless, it makes it much more accessible. So now let's go through the impacts of this debate. In terms of let's go through the main points of passion impacts there. In terms of accessibility, we gain all impacts. Any access is good. Any access to life-saving medical treatment, to doctors who can give advice, to not being afraid to just hop on a call with the doctor. That is good. It ensures that millions of Americans who are not able to typically access a doctor for one reason or another are able to get that access. That can be life-saving. That can help their health in the future. That can be preventative. It is good. So we have that net benefit. In terms of pandemics, we have that net benefit as well. Hundreds of thousands of Americans died in the COVID-19 pandemic, right? If we had been prepared, we can prevent that better, more, and we should be prepared for that. And for with all of these impacts, with the impact of better treatment as well, we urge you to vote for the AF team. Thank you, and I urge an AF vote. Or Gov, sorry.
Cool. Good work, everyone. I guess the judges, we can all come to our decisions and then we can disclose after.
Okay, thank you so much, and great job,
Thank you.
guys.
Thank you.
Good debate.